my gosh, Paxton, are you okay? Paxton, wake up. Oh my gosh. Paxton, wake up. Hi, my friend passed out. I need to get her help.
Okay, I'm gonna need you to fill out some information for me right quick.
Okay. Well, her name is Paxton and her date of birth is 6/3/96, but she's not insured.
Okay, well, we're not gonna be able to do anything for her if she's not insured.
What's going on in here?
We had a female patient come in who was passed out, but she doesn't have insurance, so we're not gonna be able to do anything with her.
Well, we cannot leave her like that. Why don't we take her back for some screening and get her treated? Here we go. Y'all come with me this way. Here we go. Y'all follow me this way. So what happened?
Well, I don't know. I know her boyfriend broke up with her last night, and sometimes she gets really upset, but I just found her in her room with a pill bottle next to her, and she was all passed out.
Oh no. Here we go. Well, no worries. Let's get her right in here, and I'm gonna go grab a nurse and a doctor for you.
Okay,
So y'all sit tight.
Hey, how are you?
Good, how are
Ma'am? Ma'am, can you hear me? Can you explain to me the situation?
Well, I just came over to her house, and because I knew she was upset because her boyfriend broke up with her last night, but she just had been, like, passed out on the ground, but she had a pill bottle next to her, but I don't know
Okay.
what it was.
Okay. I'm gonna go ahead and take some more of her vitals, and then we can talk to a doctor
Okay.
about what we can do.
Okay, Hannah, what's going on here?
She's a psych patient. We think that she overdosed last night.
Okay, so we do not have the correct equipment to take care of psych patients, so we're gonna have to transfer her. So let's go talk to the administrator and we'll be right back.
Okay.
Alright, so I've contacted them about the transfer, and right now they currently don't have any rooms available. So what we're gonna do, we're gonna let you go home, rest up, and they should be getting back to you on sometime this week about the transfer, and they'll get everything set up for you and give you a call.
Hey, we have a psych patient, and we need to transfer them, so we need you to sign off on some papers.
Okay.
Thank you so
Thank
much.
you.
All right, ladies and gentlemen, we're gonna have a little staff meeting. I just signed off on a transfer for a patient, and for the psychiatric patient, and I want to know why she was denied treatment today.
Well, when she came into the office, I was told that she did not have insurance.
Gotcha. All right. Well, I'm going to post around some EMTALA policies and procedures around the office, but remember that we will treat if they are unconscious, so make sure to send them back for screening. On another note, nurses, we need to make sure that we are available on staff because I had a patient's friend push her back to the office today, and she was left alone, and we don't need to let that happen anymore. But besides that, I'm going to post the policies and procedures. Where is this patient now?
I went ahead and dismissed her based off, I called the other hospital and they didn't have any rooms available, and I told them that they would be getting back to them throughout the week. So they were just about to leave right before we came into the meeting.
All right, well, I think we should go find that patient and make sure she is actually adequately taken care of. We don't need to leave a patient unattended. Excuse me. Here we go. I am so sorry. Here we go. So sorry for the misunderstanding. Why don't we get you into a room and get a proper transfer set up?
Okay.
You can follow us this way.
Here we go. This way.
Hi, I'm Dr. Stewart from North Alabama Psychiatric Hospital. I noticed that on some of your transfer paperwork for one of your patients, that it was incorrectly filed.
Yes, we've got that all taken care of. I'm so sorry. It won't happen again. Could you please just not report that for us?
Oh, I'm reporting this.
EMTALA violation number 1. No patient with an emergency condition can be denied treatment, whether they have insurance or not.
Resolution of violation 1. By admitting the patient, regardless of insurance status, the hospital administrator avoided the violation.
EMTALA violation number 2. A patient cannot be denied and must receive a screening exam from a member of the medical staff to determine if there is an emergency condition.
Resolution to violation number 2. By admitting the patient for screening by a medical staff member, they avoided a violation.
EMTALA violation number 3. Appropriate standards of care for screening and stabilization must be met. Simply shaking the patient does not meet this standard. In order to avoid EMTALA violation number 3, they would have to provide an appropriate screening process to the patient.
EMTALA violation number 4. When transferring a patient, hospitals are required to provide stable transfer for patients.
Resolution to violation number 4. By making sure that the patient was stable and would be properly transferred, the hospital avoided an EMTALA violation. EMTALA violation number 5. Patients must be in a safe setting before transfer. This safe setting does not include resting at home.
Resolution to EMTALA violation number 5. The hospital must also make sure that the patient is held in a safe setting until the transfer is initiated. By stopping her from going home, they will be more able to do so. EMTALA violation number 6. Hospitals are required to post signage that specifies the rights of patients with emergency medical conditions.
Resolution to violation 6. By posting EMTALA policies and procedures, the hospital administrator is now complying with EMTALA's requirements. EMTALA violation number 7. Hospitals are required to report improperly transferred individuals to CMS within 72 hours.
Resolution to violation number 7. By reporting the improper transfer, East Alabama Psychiatrics avoided a violation that would have cost them their provider agreement.
Can you help me? My chest hurts and my left arm hurts so bad, and I think I'm having a heart attack.
Well, I don't have a list of physicians on duty right now, so I'm not sure how I can help you.
I overheard your conversation and I found a list of all the on-call physicians.
Perfect. Oh, well, good news. It looks like Dr. Robert's here. He's our on-call cardiologist. I'll page him. Could you take her to the back?
Yeah, you can follow me to her room. We can just sit you here in the lobby and you can wait. But I am going to need some form of payment before I can put you in a room before a doctor can see you.
I don't even have my wallet on me. I need help now.
Okay, well sit tight and I'll go try to talk to our administrator. Hey, so I have a patient and she thinks she's having a heart attack and I asked for payment, but she cannot pay.
Gotcha. Well, according to EMTALA, you can't have payment before treatment.
EMTALA violation number 8. It is required that there be an on-call list of physicians who are members of the medical staff.
Resolution to violation number 8. By providing a list, the nurse avoided a violation.
EMTALA violation number 9. If there are no doctors currently at the facility, they are required to have policies and procedures in place to avoid a violation. Those policies cannot be to refuse treatment.
Resolution to violation number 9. Since there were no doctors there currently, they implemented their policy of paging an on-call physician.
EMTALA violation number 10. There should be no delay in medical services in order to inquire about payment from a patient.
Resolution to violation number 10. The hospital administrator was right. They must stabilize them without delay, and in fixing the nurse's mistake, they avoided a violation.
I'm literally so tired of medical school.
This residency is killing me.
Yeah, I know, same. All I want to do is to go shopping and get my nails done, but I can't because we're broke and we're not getting paid for anything we're doing.
All that will change soon. Just gotta persevere and get through it.
Soon, we have to get through our...
Hey, did I hear that y'all are med students?
Oh, yeah.
Okay, my friend, we've been studying, and I think he just passed out, and I know that he hasn't eaten like all day because he's been studying for finals, and he's on Adderall, and I don't know what's going on, but can y'all help me?
Oh my gosh, yes.
Yeah.
Let's go.
Okay,
Let's
come
go.
on. He's over here. He's right here.
Hey, buddy, are you okay? Are you okay? Look, I'm gonna check your pulse. Okay. I mean, it seems fine to me. Have you been up all night studying?
Mm-hmm.
Have you eaten anything today?
Mm-hmm.
Okay, well, I think it'll be fine if you just, if you want to take another Adderall, like keep studying for your finals tonight, because I know that it's really important. And if you want to go get something to eat, I mean, you can, but I mean, you don't have to.
You should probably just keep drinking water, stay hydrated, and you should be fine for tonight. I wouldn't worry about it. If anything else happens, I'd probably go to the med clinic. But other than that, you should be good.
Yeah, you can wait till tomorrow at least.
All right.
But I finished studying and everything, so. But I think that's it. If y'all need us anymore, then.
Yeah, thank you. Sorry to bother y'all studying.
No problem. That's what med students are for.
Bye, y'all.
Bye.
Yeah, have a good
luck.
night.
Yeah, hope you feel better.
So I guess you can take more Adderall.
Meredith, look at what I just found in our book. Like, literally.
We should probably go tell them to go ahead and
we
take
have to, or we'll never become doctors.
Actually, guys, We think you should probably call 911 or either take them to the emergency room. We're just residency students, so we're actually not qualified to do medical screenings. So it's probably best if we get them to the emergency room to let them do a proper medical screening.
And I can call 911 if y'all need me to.
Okay, cool. I think, yeah, we'll probably just take him to the emergency room.
Okay.
Come on.
Do y'all need any help or anything?
Yeah, do you want to help me get him out of here?
Yeah.
Perfect, thank you.
We can just go this way.
Thanks. Violation 11. No med student, resident, or PA can perform medical screening examinations. It must be a practicing licensed physician.
In order to avoid EMTALA violation 11, they must inform them that they are not qualified to do medical screenings and should see a medical professional for the proper screening.
Violation 12. A medical screening cannot be performed outside of a hospital setting.
In order to avoid violation number 12, the med student should advise the patient to go seek treatment at the nearest hospital.